The number of female physicians entering the workforce is growing. Today, women represent 50% of medical students. Yet they report less control over their day-to-day work, lower compensation, greater strain in the work-home integration, and are more likely to report burnout than their male colleagues. Through an 18-month grant sponsored by the Physicians Foundation, the AHA and 5 other major medical organizations teamed up to help improve organizational structures and build individual skills of female physicians through the Women's Wellness Through Equity and Leadership, or WELProject. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter for AHA. At the beginning of the WELL program, we interviewed 3 physician leaders. Today, now that the program is concluded, we're catching up with these women physician leaders to hear about their lessons learned and advice for others looking to do this work.
Welcome to another podcast in the American Hospital Association's ongoing series where we focus on important issues facing clinician leaders. I'm Elisa Arespacochaga, Vice President of the AHA's Physician Alliance, and today we are talking with our 3 women physician leaders who participated in the Wellness Through Equity and Leadership project. I'm joined by Dr. Amy Ahasic, critical care physician and section chief for pulmonary and critical care medicine at Norwalk Hospital. So Amy, just to get us started, tell us a little bit about yourself and your role at Norwalk.
Sure, and thanks, Elisa, and thanks for having me again. I am the section chief of pulmonary and critical care medicine at Norwalk Hospital, and I think since I talked to you last, we actually merged with another network of hospitals. So we are now a 7-hospital network in Connecticut and New York called Nuvance Health, and Norwalk is in southern Connecticut, kind of about an hour out of New York. My role as section chief is to oversee both pulmonary and critical care medicine, and of course, as I think we will talk a little bit about, has been particularly active this year with COVID.
And I know you've been running flat out for probably almost a year now. So can you tell us a little bit about the project you did as part of the WELL grant, and then how that's been applied in your work where you've been pretty slammed by COVID?
So the WELL program really spurred my interest in burnout of women physicians, and specifically in how leadership training or mentorship may be a tool to prevent burnout. My goal had been to build a network of women physicians and physician leaders within my own organization so that we could identify our own needs for wellness, for mentorship, and other ways to prevent burnout. I discovered, though, serendipitously, that one of my faculty, Dr. Robin Scatina, had a very similar interest. And she was able to get some funding from our hospital to really launch a Women in Medicine group and to sponsor some initial events at our hospital. So that started with a happy hour where a few of us in leadership roles were able to speak about our paths in medicine and also about topics around leadership and mentorship. So, for instance, I spoke about coaching, mentorship, sponsorship, what those are, how they differ, why they are important for women physicians in particular. And I think what has made this group really nice as well is that Dr. Scatina really felt strongly about including all of our women residents and fellows in these events. So it really encompasses women across all the phases of their careers and could be a platform for mentorship in and of itself. And then, of course, COVID came, and it made it very hard for us to meet in person, but we actually were able to continue to do Zoom sessions of topics that the membership were interested in, including things like pathways in medicine for the trainees and other things about academic medicine for those later in their careers. And that's been really nice. Dr. Scatina actually was able to pair faculties and trainees together kind of in one-on-one relationships for mentorship, which has been very nice because I think it exists outside of the training programs kind of as its own relationship. And I think that's been very successful. So having a partner who really was able to spearhead and champion this when I couldn't has really been wonderful. And I've been able to really participate and benefit in this group myself. Because as you mentioned, since about March of 2020, when we had our first COVID case, I have been, I think, living and breathing COVID, which that's probably a terrible pun, unintended pun, but, it's really been COVID all the time for, like you said, it's been almost a year now. And as I mentioned, we're about an hour outside of New York, so we were hit early with that same big early wave in the spring when New York was really overwhelmed. And so my administrative responsibilities really picked up quite a bit, but it's been a really unique opportunity to collaborate with colleagues across our network. Our merger into 7 hospitals was fairly young, and COVID actually was a great vehicle for us all getting to know each other and having to work very closely together very quickly, which was a real blessing, actually. I've been able to participate in our incident command structure at our hospital and our network around our COVID response. Also the clinical response, so having a network-wide group trying to keep up with all the changing information, right? Like what are the therapies we should be using for COVID? What's the PPE we should be using for COVID? And that's been a really nice opportunity as well. I think there have been upsides to COVID, and one of those has been that I really in my career have never seen such open sharing of information across not only the United States, but really the world. I remember distinctly in the spring, we were getting shared emails from physicians in China about, with their experiences in Wuhan and what they were doing. And then it was Italy and Italian physicians sharing information. And then it was Washington State. And then it was New York and on and on. And that included things like sharing policies and protocols and treatment regimens that I think typically hospitals or health systems try to keep kind of internal or close to the vest, but people have been so open and sharing, and we've really all learned together. So that collaboration and sharing of information has been really a fulfilling part of this. And I think the ability to kind of be a part of the greater response of our system has been one thing that's personally helped me fight burnout throughout this as well. One thing I wanted to mention is that I do worry that we as a broader medical community have really not adequately addressed burnout related to the pandemic. I think we know it's happening. We worry about it. We know, particularly among specialties like critical care and certainly others that are particularly hard hit by COVID, that it's present, and we should be finding ways to take time off or decompress. That's actually really hard to do when we still have high case rates and our hospitals are packed and there really aren't days off from COVID. So, I think it's something we have to think about on a longer term basis. Our group, for instance, the Women in Medicine group, I think that is one great vehicle to combat burnout that we need to lean on because we're living a shared experience, and that kind of communication among people who know what you're going through, I think, goes a very long way. But I think the truth is a lot of us haven't really had the time to stop and reflect on everything that we've gone through and seen over this last year. I'm in critical care. I'm used to death. I see death. But what I saw in the spring in particular with the amount of death, families and, friends not being able to visit patients who were dying is just nothing like I've ever experienced or most of my colleagues have ever experienced. So I think we have to recognize this as really a trauma that symptoms may not emerge for a while. And I think what's going to be really important for our efforts to prevent or deal with burnout is really to stay vigilant, looking for those signs and symptoms, even when the cases start to die down and when maybe we have the chance to actually let it all sink in. So that's something that's very much on my mind in terms of what we need to do going forward.
Absolutely. And I like that you've already set in place many different ways to build some peer support opportunities. Peer support is one of those areas where you're going to be able to talk with someone who's experienced and understands what you have experienced is incredibly powerful.
Yeah, I agree with that. And we have had a peer sort of hotline, and that's gone beyond physicians because obviously physicians are not the only group affected here, and peers within the hospital who are available for people to reach out. And I worry in the greater medical community we may end those things too soon, and so I think we're going to have to put attention on keeping those kinds of things in place for some time.
That sort of leads a little bit to my next question, which is what is some of the advice you have for others coming from your experience, both from the Well Grant and then this last year of intensity? It sounds like to start, we need to keep that vigilance up.
Yeah. And, I think one of the biggest pieces of advice I have reflecting on this last year and this last experience is actually pretty simple, which is find what fills your cup, find what gives you professional satisfaction on a day-to-day basis, and obviously outside of the workplace as well. But for me, professionally, that means having a meaningful role in the operations and the success of my organization. And that's kind of a realization I had a few years ago that led to me taking the position I have now. But that's really been emphasized strongly around COVID because it's been so all-encompassing, and it's really been an unexpected opportunity to collaborate as a leader and kind of step up in what has been an incredible need for many people to respond. And I love seeing patients. I love clinical care, but I know that that is not sufficient for me to feel professionally satisfied and happy. And so understanding those kinds of things and realizing what kind of fills your cup is a really important tool to preventing and combating burnout. Because, again, the stress has been incredible around COVID, really overwhelming at times. But when you feel like you believe in the mission of what you're doing to serve your community and serve your patients and feel like you are a cog in that wheel, I think for me that's been the thing that's made it much easier to deal with this crazy situation we've all been in. And then finding those things outside of work. The time outside of work seems to have been squeezed down quite a bit in all the phone calls and meetings that seem to encroach on the evenings and weekends. But at the same time, coming home to my kids, my husband, cooking a meal, going for a walk are really uplifting. I'm sure like everybody else, it's like Groundhog's Day. Like we have nothing to do and nowhere to go. But at the same time, just having those people to come home to, I think is really helpful and important too.
Absolutely. The home team is as important as the work team in keeping us all on an even keel, I think.
Yeah.
Well, thank you for sharing your experience and for sharing how you've used the work of the Well Grant. And we look forward to having you serve and join us as a mentor on 2.0 of the next grant that goes out.
Oh, I'm really looking forward to it. It's been a wonderful, wonderful program and opportunity for me and a great sisterhood for all of us who participated.
Wonderful. Thank you again.
Thank you.